This episode sponsored by Stuart Arango Oral Surgery. Learn more at saoralsurgeons.com. And Kathy L. Wall State Farm Agency. Learn more at kathylwall.com. Welcome to the Bubba Lounge. I'm Martha Jackson, and today we are going to be talking about hormones. Everywhere I go right now, I feel like all the moms are talking about hormones, what is working, what's not, just some symptoms that they're having and things that they would like to improve. And I feel like I have found the perfect person to talk to us. Today, we have Dr. Priya Patel MD joining us, who has recently opened a new practice called Feminology MD in Preston Center. Her practice is completely focused on the health and wellness of women, and she provides her service on a concierge basis. I recently visited with her and had an amazing experience, so much so that I wanted to share it with you all. So in return for a trade out, I have invited her to join us today on the show. If you're having questions about hormones and hormone therapy, you are going to love the show. Welcome to the show, Dr. Patel.
Thank you for having me.
So you decided to go out on your own, which I always love talking about new businesses on our podcast. You decided to go out on your own about a year ago. Tell us about that experience. Tell us why you did it.
Yeah, so absolutely. So I was in a traditional OBGYN practice, about 50% OB, which means delivering babies, and about 50% gynecology, which was, more traditional women's health, pap smears, bleeding issues, stuff like that. And I just felt like in general, insurance was significantly dictating care. And unfortunately, I felt like that oftentimes limited the amount of time you could spend with the patient and even the different avenues of treatment that you could even offer. So, and I particularly felt that with GYN care, and a lot of that was women's overall wellness and health and things like that, that there really wasn't time to look at overall wellness and anti-aging and preventative health, and that it was all really more treatment driven. And someone would come in with a problem and you would just try to slap a quick solution on it because you had 15 minutes and a finite period of time. But maybe really they had a myriad of issues that need an hour to talk about. And so I just felt like in my own practice personally that, the women's health piece, I always felt shortchanged and short on time. And I felt like I was sometimes shortchanging my patients too, which I hated. And so I sort of had always kind of had this idea that, I wanted to do women's health and overall women's wellness differently and better. And so I sort of, grappled with how to do it and what that looked like. And finally, I sort of, decided that it was kind of now or never. And so I decided to leave my current practice. And then simultaneously, I decided that if I was going to do sort of overall and more holistic women's wellness, that I really needed to sort of go back and get functional medicine training. So I went back, did additional functional medicine training, and then got board certified in that. And then I felt like that in combination with sort of my traditional gynecology training would really round out the picture and allow me to better take care of my patients.
Well, I absolutely love that because you're so right. You do feel so rushed with your appointments and when you're going to the doctor. I actually have had a couple of doctors that I've had the opposite happen, that they talk to me too much and ask me too many questions. And I started getting anxious because I knew that they had other patients that they needed to move on to. But then there was one incident where I had to see the PA because my doctor was not in on the day that I came in. Well, I got the experience for sure. She, in no certain circumstances, let me know how annoying she found me to be because I wanted her to look in my chart and find out my reaction to a certain medication. And she said 2 different times, "You're asking too many questions and we only have basically 15 minutes and I need to move on. Like you are like taking too long on my day here." And it was very uncomfortable because I had some stuff going on that I wanted to talk about.
Well, I think it's frustrating, right? A lot of times you're waiting to see the doctor for an hour plus. A lot of times you're waiting weeks to even get the appointment, and then you're waiting an hour at the appointment, and then you have a list of things to go through, and then a lot of times you're really rushed to even get through that.
Yeah.
So you've now waited weeks or months for this short period of time, and then you can't even get through everything. So yeah, I think that's incredibly frustrating for people. And I think, unfortunately, what we're dealing with more and more in our healthcare system, unfortunately.
Right. Well, I know that you offer a huge full gamut of services, like so many things that we could probably fill up the rest of the year with episodes on. But I wanted to focus on hormones because everywhere I go, every group of women I'm around, it feels like everyone's talking about it right now. And I'm sure it's the age that I'm in. that people are talking about what's working, what's not working, problems that they're having, who should they go to, who should they see. So tell me about that, because a lot has changed over the years in regards to hormone therapy. At one point in time, we were told specifically estrogen was really bad for us. It causes cancer. But new studies have come out and we're seeing things differently. Talk to us about that. What's changed over the years?
Yeah. So really a lot of our data and understanding of hormone therapy originally initiated with the 2002 study called the Women's Health Initiative, which really shaped the narrative for the next 20 years. And from that study, sort of initial preliminary data suggested that so they looked at estrogen and progesterone, which is another hormone that we sometimes supplement with. And they found that progestin, which is a synthetic derivative of progesterone, it's all very confusing, potentially may have very little, but very minorly increased the risk for breast cancer in a certain subset of patients. Now, over 20 years, additional data, additional studies, we've now realized that actually, one, that study was faulty. It looked at a older patient population that was typically older than 65, which is not even who we are usually initiating on hormone replacement therapy. It's usually something that's initiated much earlier as women navigate menopause. And the average age of menopause, is 51.8. So obviously you're dealing with those, initiation of hormone therapy typically much earlier. So one, the study was flawed because it was looking at a much older patient population. And then two, they realized that it was looking at a completely different form of progesterone, a synthetic progestin that we don't even recommend using anymore for hormone replacement therapy, or at least it's not our first choice. And there were a lot of other semantics and nuances that I could bore you with. But the bottom line is that study we realized was completely incorrect. And when we did additional studies and looked at different forms of medication and different ways that we could give back hormone replacement therapy, it actually completely shifted the narrative. And we realized that the original data that we were sort of practicing medicine with for the next 20 years was wrong.
Well, I mean, it's just so unfortunate that they do all these studies and it's supposed to last 20 years because, I mean, things are ever evolving and changing by the day. And so I don't know. That's just too long.
Well, and I think it was a study that was particularly well publicized. And even as doctors, I mean, when I trained when I trained 15 years ago, we really were taught that, hormones, you want to use the smallest dose for the shortest amount of time, only for the people that need them. And it was because we sort of feared hormones and we thought that they were going to cause all of these potential adverse effects. And so I think we were truly
Okay, I have the same problem.
So I think we were actually, as doctors, we were sort of practicing out of fear. And then with additional studies and data and time, it became more and more apparent that actually it doesn't increase the risks that we thought, and that in fact, estrogen probably decreases all-cause mortality, and that it reduces the risk of osteoporosis, reduces the risk, probably has some cognitive benefit, may even reduce the risk for dementia, has cardiovascular benefit, can reduce the risk for adverse, heart outcomes and cardiac issues. And so that really the benefits far outweigh the risks if you really understand all of it and the nuances.
Finding an oral surgeon is hard enough for yourself, and when it comes to your kids, it can feel impossible. We suggest our friends at Stewart and Arango because from emergencies to wisdom teeth and everything in between, they have you covered. Stewart and Arango are board certified with MDs who specialize in full scope oral, facial, and implant surgeries for both children and adults. Not only is their office state of the art, they lead the industry with the most advanced techniques and procedures. And when it comes to safety, they are pediatric and adult advanced life support certified and use a 3-day local anesthesia, which keeps you comfortable while limiting the use of opioids. Best part is, they're conveniently located at Northwest Highway and Hillcrest Avenue. So if you want the best of Big D caliber oral care, come see the friendly staff at Stewart and Arango. To learn more about them or book your appointment, visit saoralsurgeons.com. That's saoralsurgeons.com. Well, you just answered my next question. That was going to be, what are the benefits from doing these? But how long should a woman stay on hormones? That's a big question I hear people talk about.
Yeah, and that's actually a hard question to answer. I think it really is on a case-by-case basis.
Yeah,
I think it depends on the other medical issues, that a woman is dealing with. It depends on why and when they initiated hormone therapy, what hormones they're taking, what their current symptoms are. And I think you sort of have to put all of that together to sort of determine what makes the most sense for that person. But I think that is very individualized.
Yeah, that makes perfect sense, as with any medical treatment.
But I think on average, assuming that a woman initiates hormone therapy, in her early 50s, probably realistically, you could at least be on it for about 10 years.
Okay.
And some may be on it a little bit longer and some shorter, just sort of depending on their health circumstances and what's happening.
Okay. Well, I have definitely gone through menopause. I am in my 50s, and I did start hormone treatment in the earlier part of the 50s. And I felt really good, like leading up to 50 and leading up to menopause. I mean, probably better than I had in many, many years, like lots of energy and really, really great. And then all of a sudden, poof, one day, all the energy was gone, the brain fog, everything happened. And I got my hormones tested, and I was out of everything.
Yeah.
And I just felt awful. So, I mean, tell us some of the symptoms people should be looking for so they know that they're not going crazy and that maybe they should have their hormones checked.
Yeah, well, the list is long. And I think I would tell you you're actually one of the lucky ones because some women deal with like perimenopausal symptoms for like 10 years leading up to menopause.
I've heard that, yes.
So, sometimes it's not uncommon to have a 38, 39-year-old or even a 40, 41-year-old who's already battling a lot of these perimenopausal symptoms. And they're like, well, I feel like I'm too young for menopause. I'm still having cycles. But, they may be having perimenopausal symptoms because they're having significant hormonal shifts that are causing symptoms. But to answer your question, what could be these symptoms? So more traditionally, we think of hot flashes, night sweats, fatigue, brain fog, memory changes, mood swings, irritability, emotional lability.
Check.
And then some of the other things, we can have vaginal dryness. You could have decreased sex drive, pain with intercourse. Sometimes it can actually worsen urinary symptoms, like you can have increased urinary incontinence where you're leaking more, or even urinary urgency or having to go to the bathroom more often, or sometimes feeling like you need to void and not being able to make it in time to the bathroom. And then even sometimes other, very commonly difficulty sleeping, or sometimes you can get to sleep, but then frequent nighttime awakening and, your mind's racing, harder to get back to sleep. So in general, disrupted sleep. Sometimes you can have a worsening of anxiety or new onset anxiety. Same thing, sometimes a worsening of depression or just kind of new onset depressed mood or just sort of feeling down or hopeless. Oftentimes you can sometimes more atypical symptoms like joint pain, dry skin. Some women will have a flaring of acne, which is a real doozy, and we all love that one.
You're old and you're breaking out.
One benefit of, getting older.
Right.
Turns out it's not. And then weight gain or just inability to lose weight. And then a lot of that is that sort of central weight gain where they're like, I'm just gaining weight around my midsection. I can't get it off. Nothing I do makes a difference. Some women can have headaches, gum disease. That's a lovely one. Yeah.
This is a very long list, like what you
I'm
said.
Sure I'm leaving out a whole myriad of symptoms,
Well,
but
that is
those
plenty.
are the ones that are top of mind.
I wanted to give a personal thank you to our good friend and show sponsor, Kathy L. Wall State Farm Agency. We have known Kathy for more than 15 years, and there is no person we trust more when it comes to insurance than Kathy L. Wall. Kathy is always available to help you find the right insurance for your family needs. Whether it's covering your home, auto, or providing a life insurance policy tailored to the unique needs of families in Highland Park. My family trusts Kathy with our insurance, and we hope you will too. Please visit kathylwall.com to learn more and let her know that Martha from the Bubble Lounge sent you. Well, let's talk about hormone therapy because I know there's different ways to do it. There's pellets, there's creams, there's pills, there's this and that. I probably don't even know everything that's available anymore. But I'm sure it's individualized, but how do you approach therapy with your patients?
So I usually, typically will get labs to sort of understand where they're starting and where their numbers are starting. And then I typically will sort of combine that hard data with symptoms because both are sort of equally important. Sometimes numbers, we say numbers don't lie, but sometimes numbers are not exactly congruent with how someone is feeling. So you really have to look at labs and numbers in the context of how they're actually feeling. And together you really get the whole clinical picture. Then once you sort of understand the clinical picture and where they're at, we really look at what symptoms they're having and what issues we're trying to solve, and what their goals are, depending on what those symptoms are. And then typically you'll look at someone's health history and what their pre-existing medical conditions might be, whether they have high blood pressure or history of cardiac disease. Then a lot of times you'll look at family history and whether there's heart disease or dementia or other things like that. And then once you sort of have that full picture, then I typically will walk through what the different options are. Traditionally, I would say once upon a time, we would quickly reach for oral estrogen. That was sort of the easiest thing to give. It was cheap, and it worked. But really now we understand that oral estrogen is the only form of estrogen replacement that really is associated with increased risk of stroke, increased risk of blood clots like DVTs, and even sometimes increased risk of heart disease like heart attacks and things like that. So now often don't reach for oral estrogen as our first choice. So then that leads you to, the other choices. And so there's creams, there's patches, which are very commonly used. And then sometimes pellets are another option for individuals that don't necessarily want to have to use something daily or multiple times a week. And then as we work through which option is best for each person, then kind of talk about, do you want to use something daily? Do you want to use something weekly? Do you not want to, do you want to use something, you want to do something every 3 months so you're not having to do anything on a daily basis? And so just understanding, those different things and lifestyle and what is going to be most convenient to someone and then what they're actually going to follow through with. Because if you give someone something daily, but they don't take it, it's not going to work.
Now, I find that so interesting what you said about estrogen, because a few years ago, I was complaining about some symptoms to my OBGYN, who I absolutely adore. She delivered both of my kids. She goes to my church. She lives in the neighborhood. I think I would be best friends with her if she wasn't my doctor. But based on the things I was telling her, she goes, well, I would just give you estrogen without even looking at your blood work. And that just didn't feel right to me. Like, that is why I have chosen to go to someone that is a little bit more specialized in the hormone therapy.
And I think, a lot of that is just because I would say, and I don't want to ruffle any feathers with this, but I do think with OBGYN sometimes, and I am an OBGYN, so talking about myself, but I do think, and this is probably a function of our healthcare system in general, but through residency training, and you do 4 years of OBGYN specifically after 4 years of medical school. So you think that would be an abundance of time to get adequately trained on hormones. But I do think that, in general, hormones, I feel, could be better taught in residency. And that was one of the reasons I really felt like I wanted to go back and do the functional medicine training, is that I felt like I had a lot of the knowledge, but that the field was ever evolving. And, the information I had was more than 10 years old. And so I think to really stay up to date on that, it's something that is constantly changing. And what I was taught, even in my training more than 10 years ago, is different than I think a lot of the information we know now. So I don't think it's that anybody by any means isn't trying to do the best thing for their patient, but I think there's just a lot of nuances that we're understanding, year after year, that is just different than maybe what people were taught when they trained.
Sure. Well, there's just so much in the medical field for you all to keep up with. Like, it would be hard to be an expert in every single area. So I like what you're saying. I do feel like that they should teach more with the hormones, because it's such a huge part of how we're feeling.
And I myself thought, maybe this was isolated to my program, but in talking to a lot of colleagues as well, they feel the same, that, we get phenomenal surgical training, phenomenal obstetric training and OB training and all of that. And I think this just goes back to women's health in general, that I think sometimes the hormone piece of it is sort of glossed over. And that's just sort of, I think, how traditionally things have been done for decades.
Right.
And a lot of textbooks were written 30, 40 years ago, right? And then they've just sort of been updated. But the fundamental principles and what was in there have been around for decades. And I think a lot of times that, 40s and 50s in women's health was just sort of glossed over. And there was a little bit of a grin and bear it mentality. And I think women are tough, and they did grin and bear it really well. And so I think it was just sort of ignored, which is, how we ended up here. This is probably, I think decades of women probably needlessly suffered or didn't maybe get optimal treatment because it just wasn't something that we looked at perhaps as closely as we should have.
Yeah, I absolutely can't imagine just suffering through this. Like I said, leading up to it, I felt amazing, but then afterwards, just a huge crash of energy and brain fog. And I still don't think that we have our hormones quite right with me. That's why I'm started coming to you. I'm a new patient, and I'm hoping that we can get things ironed out because I do lack energy and definitely the brain focus and motivation just to get through your day-to-day grind. But I feel awful for those people, before us who just had to grin and bear
Yeah.
it, like what you're saying. That's so sad.
It is actually really sad. I also think it's a testament to how tough women are.
We really are.
Because I think for decades we just dealt with it, and it wasn't, it's not necessarily something that's glamorous, or that the pharmaceutical, a lot of times pharmaceutical industry goes after high dollar items, and hormone health is maybe not necessarily one of them. And so I think it just kind of got put on the back burner, or just it wasn't where high dollar amounts were going towards, research funding.
Well, how can somebody that thinks that maybe they need to get on hormones, what kind of route should they pursue?
Yeah, I mean, I think, the first step is to really take stock of how you're feeling. I think, I kind of alluded to this several times, but I think oftentimes as women, we just sort of make it through the day, right? We're in a little bit of a survival mode. A lot of us have children, and you're just running around and prioritizing everyone else first. And I think we often put ourselves on the back burner, right? You're just trying to make sure everybody makes it through the day, and it's, one crisis to another, or just day to day. And you're like, eventually I'm going to get to myself. But sometimes that eventually never comes because new things come up. So I think first is to just, take stock of how you're feeling and really just pay attention, see how energy feels like when you wake up, see how you're kind of doing through the day, pay attention to what you're eating, what you're putting in your body, right? We now understand that gut health and nutrition and all of those things play a huge part in hormone health. And, you could slap all the hormones on somebody, but if they're not eating well, if their gut health is not in a great place, nutrition is poor, it's only going to do so much.
Right.
And so really you have to look at the body as a whole. And I think this goes with any medication. When you're solving a problem, and in healthcare in general, when you're solving a problem, you don't want to just solve that problem. You really need to look at it as a part of everything, so that you're going to solve that problem, but overall everything should sort of function and do better, because we have one body. And so to really think of it as separate systems is not really how the body works. We really need to think of it as sort of one unified entity, and understand that if we fix this thing, how is it going to affect everything else? So I would say, one is just take stock of how you're feeling. And then once you sort of identify, okay, I feel like this isn't great, or this isn't great, or this feels different than it used to be, then I think it's important to probably, see an OBGYN. If you think it's a hormonal thing, if it's more of a primary care issue, then obviously a primary care doctor. But I think, if it's more of a hormone health stuff, then I think typically an OBGYN is where I would start. And then sometimes if you can combine that with functional medicine, sometimes that's not always bad either, depending on what's going on. And then usually, lab work, right? And it's important to sort of have that discussion with the provider and talk about what your symptoms are. And then they'll determine what workup is appropriate, whether that's just traditional lab work, whether they think there's actually something specifically wrong, or if it's just hormonal changes, whether they feel like additional functional medicine testing might be necessary, just kind of depends. And then they can sort of, and you can decide together what workup seems appropriate. And then I think you do the lab workup, do whatever is necessary, get that testing done, and then you follow up, and then sort of go through those results, and then make a plan for what makes sense, whether that be hormone replacement therapy, or for some people, that's not the solution. For some people, it might be a thyroid abnormality, or there's just a big nutrition gap, and, they have a lot of gut inflammation, and that might be the source of a lot of their issues. So I think it's really, kind of identifying what the different sources of their symptoms, and then, solving them one by one.
Well, so I love everything that you're saying. And like I said earlier, is I'm a new patient of yours. I literally have seen you one time, and we've had our initial meeting.
Yes.
And it did go on much longer than 15 minutes. It went a little longer than it should have, right?
Yeah,
so
it's longer than an hour. Yeah.
I love how much time you spend with your patients. But walk us through the process of coming to see you, because so many of us are used to only going to providers that take insurance and your concierge. So tell us about that whole process.
Yeah. So just because of all of the constraints that insurance sort of places on time, and even services that they'll cover, et cetera. My practice is concierge in that, it's cash-based. So there's not a certain fee that you pay for access for a year or anything like that. It's just fee for service, meaning you pay per visit. And I typically will start with a 50-minute, so almost an hour new patient consult, where I will walk through all the symptoms, really understand medical history and what your goals are. Typically from that, we'll determine together what labs and maybe additional functional medicine tests we may or may not need to do. And then I usually will have you follow up for another 50-minute or almost hour visit. So we've now almost spent, by the end of that, typically 2 hours together. And at that follow-up visit, we usually will sort of walk through all of the symptoms and then make a plan for how we're going to address each of those things. And then typically we may follow up 6-8 weeks later, depending on what treatments we initiated and if labs are necessary, things like that. But my goal is to really sort of, within those 2 visits, really have someone leave with a comprehensive plan in place. And then after that, we're really just needing to follow up as needed for maintenance or tweaks or things like that. Or if certain symptoms weren't solved, then we can sort of follow up and address those things. So that's typically kind of the process.
Well, that sounds easy enough. Well, how can our listeners find you?
Yeah, absolutely. So our practice is called Feminology MD. So our website is www.feminologymd.com or Instagram Feminology MD. Or you can always call our office, 469-242-6292.
Perfect. And she is conveniently located in Preston Center, right in the bubble. Well, Dr. Patel, thank you so much for joining us today. Everything that you shared was so valuable, and I know it's going to help a lot of women out there.
Well, thank you so much for having me. It was a pleasure.
That's been another episode of The Bubble Lounge. I'm Martha Jackson, and we'll catch you next time.